New debate now over Obamacare after Aetna pulled out of most health care exchanges. Now, Senator Bernie Sanders is saying that this retreat is actually proof that we need more regulation in that public health care option. But would that actually lead to more problems? The Heat Street political reporter Jillian Melcher and Democratic strategist Leader-Chivee on the fallout here. All right, Lauren, let me start with you. This is bad news. I mean, just really, it's awful. You've got over 700 counties in this country with only one provider.
Yeah, listen, Bernie's only half right on that. So I don't agree with him that this is a regulation issue, but I do agree with him that this is part of the fallout of there not being a public option. Because the problem is, without the public option, you do wind up with more lower income Americans who often have more serious health care issues in these private plans, and there's not enough of a pool because they're separated state by state for it to actually sustain the model. This is why, you know, there are two big problems that have happened with the ACA, which, you know, I think have to be fixed, not repealed, but fixed. One is many of the states rejected the Medicaid money that would have actually offset this issue, because you would have had more of the poor, lower, and middle-income Americans in Medicaid in a public option instead of having to be supported by private companies like Aetna. Most Republicans have rejected that. It was a big mistake. It's a mistake for them financially. That's one of the things that has to be fixed. And just a lack of public option is going to continue to erode private companies. The other piece is price regulation, because we don't have any of that. You know, the burdens become enormous. So I know, most people on the right wouldn't agree with me on that, but I think we're seeing the results of those two choices in the ACA.
Is that your assessment on this? Is that your post-mortem on this thing?
I mean, I think what we're seeing is that the government did a terrible job of predicting the market. They didn't understand who was going to sign up. They didn't understand what the cost to insurers was going to be. And that means that the answer should not be more government intervention. I mean, if you look at 2013, you had 395 insurers participating. Flash forward to last year, it was 287. That's more than 100 people dropping out. The insurers who are still on are hiking premiums, many of them by double digits. Consumers are left paying more and having fewer options. The answer to this is not just to streamline them and to push them into more of a government system. I mean, look, no, they absolutely do not have the options. Well, they have 100 fewer insurers.
Right, but there were 15 million Americans who had no health insurance before the ACA. There's no question that there are serious problems with the ACA that absolutely have to be addressed. But the question is, are we going to just go to these extreme measures which says, get rid of all government health care?
That's such a straw man to say that it's either, more regulation or more of this, or nothing at all.
Well, there's a difference between regulation and offering a solution to a problem that only government can solve. In this case, unfortunately, we had 40 years of a private sector insurance program which left tens of millions of people out of this.
Worse since the government took over.
Well, it's a question. Well, I don't think it's worse for families who finally have coverage for sick children who couldn't get covered.
What about people who are working, though, and no longer have their doctor, who can no longer afford their deductibles? What about small businesses that can't grow? There's some serious economic damages from this, that whether they were, and people warned, by the way, about these damages.
Well, keep in mind that some of the compromises that wound up that left us with the state exchanges were actually because Republicans refused to allow to have any kind of public option, which would have actually mitigated.
Compromise with the way this healthcare bill was passed to begin with. So I don't really buy the compromise.
Well, you've got Republican governors all over the country who rejected free money in order to expand Medicaid, which would have offset the problem.
Initially by free money that ultimately would have run out, and meaning that they would have had to tax their citizens more.
My only question
They didn't take that bait.
Listen, I'm not saying that I think the ACA, I'm not here to defend every part of the ACA. The question is what other solutions do we have in a system where private health insurers have no financial incentive to cover people who are ill, who have pre-existing conditions, or who can't get insurance any other way? We have a lot of things that we got to work out.
But give me some solutions. Barriers help? Would that create competition? And historically, doesn't competition drive prices lower?
Yeah, it absolutely does. And I think that's one thing that we should look at out of many. But if we're looking at what's happening right now, it's the government failing to predict, failing to be able to come up with a system that's going to operate like they said it's going to be. It's broken promises, and the answer to that is just not more government.
Well, but Medicaid and Medicare are actually the examples that actually, they work in total counter opposite of what you just said. We are actually capable of as a country of running some government-related health care, which the vast majority of participants are very happy with.
You can throw out the VA for that,
too. You can
talk about that being a
needs-
single payer
No
system.
Let me change the subject
No question
real
about
quick.
that.
On Hillary Clinton's tax plan versus Donald Trump's tax plan. Again, it's almost the same core argument, right? Big government, nanny state will take care of you. We don't think that we live in a country where you can pull yourself up by the bootstraps, but we've got your back, Lauren.
I know you love that talking point. It's just simply not true. And you've got a huge number, unprecedented number of Republican economists, conservative economists, who say that the Trump economic plan is a disaster, will add trillions of dollars to the deficit, which is the opposite of Republican principles on the economy. And the Hillary campaign is absolutely not creating a nanny state by saying that we need to invest in things like infrastructure, which don't get done any other way except through government stimulus.
Mark Zandi is the guy that she always refers to, and I think he's more of a Democrat, but he worked with the last Republican candidate. Lower taxes, fewer regulations, unleashing the potential of the economy, or higher taxes. Essentially, that's what it kind of boils down to.
Well, I think with Trump, it becomes more complicated because you look at somebody who in his first debate was all about universal health care, who when Hillary Clinton says, we want stimulus, says, no, I'd double that stimulus. So he may be promising a lot. He's saying that we're going to, cut taxes while also spending more, while also cutting on and on, contradictory things. Well, I'm just not convinced that that's a coherent plan.
I think the bottom line is that, lower taxes, lower, regulations, I think will help. But to your point, I think either candidate will see more deficits, what used to be, and debt, which used to be a critical topic. Not right now, but it will be again. 19 trillion and counting. Thanks, ladies. Appreciate it.